Welcome everyone to another Chats with Your Advocate. I'm Tiffany James. I'm the co-owner of Divine Wellness Partners. I'm a board certified patient advocate and nurse practitioner. We have here today Dr. Sandra Graham. She is a board certified patient advocate and she is also a licensed clinical social worker. She is the co-owner of Divine Wellness Partners. And then we have our guest, Miss Margaret. She is our special guest today and a cervical cancer survivor. So she is going to be here today to tell her story with us. Okay.
So thank you all for being here. I invite you all to be present, to enjoy, to learn. We have a very important topic. We're all excited to hear Margaret's story. I invite you all to be present, to learn as she embarks on sharing her story, for which we are so grateful that you're here.
Thank you so much.
Thank you. All right, so for today, our focus is cervical cancer awareness, early detection, and the importance of self-love every day.
Absolutely. And so we're going to start with just opening up on Divine Wellness Partners and why we're here, right? Why we exist. And so we are a medical and mental health advocacy practice. We specialize in care navigation and closing of gaps. So a lot of us in here today work in healthcare, or you know someone who may have health issues. Oftentimes we see people who, after the visit, they don't know what to do. They're back in the hospital. They're falling through the gaps. They have questions. Care is disjointed. So we specialize in the after visit. We specialize in that gap between hospital stay, ER visit, office visit. So we are there to guide each and every one of our clients through that process. And it's personalized based on what speaks to them in their journey, because ultimately we want to see them have positive health outcomes and wellness. Okay. And so with cervical cancer awareness, we're really going to focus in on talking about why that's important. Women's health, we're all, for the most part, women in here. And so we know that that's very important. We want longevity. We want quality of life. We don't want cancer. So that's why we do these chats. We want to bring health literacy to the forefront so that way everybody knows the questions to ask, what to do, signs and symptoms to monitor for. And prevention is always better when we can be proactive instead of reactive. So that's what we focus on. That's why we're doing this today. Okay. And so I have my notes here because I want to make sure with the health literacy that I convey to you all exactly why cervical cancer screenings are important, because it's highly preventable. It's one of the most preventable cancers that we have when we screen. Okay. And so what we screen with is something called a pap smear. Many of us, not all of us, even the men in the room probably know what a pap smear is, right? And so the virus that causes cervical cancer is called HPV. And we have the ability to not only on that pap smear take a little sample of that cell from the cervix, just a little scraping there, right? And look at that to make sure there are no changes that are either precancerous or cancerous. And then we also have the ability to screen for that HPV virus. Okay. Again, if we can catch that in a precancerous stage, we can prevent cancer. Now, the issue with cervical cancer is a lot of times in the beginning, there's no symptoms. We don't always know. We don't know until, it's too late and things have spread or, things like that. But it is a slow growing cancer. So again, that screening is so important. Now, with the early detection, the symptoms, you may notice a little bit of discomfort, irregular vaginal bleeding, things like that. Okay, that may be something that you see early on once things have progressed. Okay, so again, just monitoring your body, looking at everything, making sure if you have issues, those subtle symptoms, you get those checked out. You get them checked out before it becomes big things. You may get some abdominal pain. If it's persistent, you're having spotting, go get a pelvic exam. It may be nothing, but it's always good to have those things checked. Okay. Now, there's a couple different guidelines that we as providers look at for screening for cervical cancer. The general gist of it, whether we're looking at the WHO guidelines or the ACOG, or um, it's just early detection. So, generally at age 21, we start screening. And from 21 to 29, we generally screen every 3 years. Now, there are outliers with that. If you have certain risk factors, certain medical conditions, screenings may happen sooner. Starting at age 30, we do the HPV co-testing. Again, some situations do require earlier screening. for that. Some of the guidelines recently changed and they are really pushing for that to start at 25. Okay, because again, early detection. We're just trying to get everybody to align with that, so it takes time. Some of the organizations are a little more proactive than others, and we just, as providers, we kind of identify with what guideline speaks best to us, right? But generally, from 30 to 65, that's when we're looking to do the HPV co-testing. Okay. After 65, if there are no risk factors, and depending on how you feel, you may or may not need to continue screenings, but that is definitely a conversation that you have with your provider. It's something we call shared medical decision making. And that's with any test, not just pap smears. You know, whenever you get ready to do something or you're having questions about your care, preventative or tertiary treatment, you always want to have those conversations. And I tell everybody, if you have a provider that can't sit down and talk with you, even if it's just for a second or two, if they're busy, then find another provider because it's your life. You know, you should be able to be heard. Your questions should be addressed. So if you do not have a provider that is willing to listen, find someone else. There's someone that will. If you need an advocate, we're here, right? And so when we when we talk about treatment, so let's say precancerous cells are identified on the pap smear or cancerous changes. There's a couple different things that they do, all the way from something called a colposcopy. They look at that, look at the cells. Sometimes they biopsy, do different procedures. But again, because cervical cancer is slow growing, the sooner you find it, the less invasive things have to be done and you can go on and can just continue your screenings as your provider recommends. Okay. Um, in the advanced stages, sometimes you do require, radiation and things like that. But again, we're having these chats to ensure that everybody's doing the screenings ahead of time. So we're not having to get to that point. Listening to your body is the key. And don't be afraid to go to the doctor. I tell people that all the time. A lot of my patients come in and they're like, I don't like doctors. And I'm a nurse practitioner, so my joke is, well, I'm not a doctor, and so I let them know I'm not a doctor. You can come see me anytime, because I don't want people to be afraid to get help. And unfortunately, a lot of people's experiences have been negative in healthcare. They go and they're not heard, they're misunderstood, and they don't want to come. They don't want to go. So I just, again, before I move on, just don't be afraid to get yourself checked out. And if your doctor is not listening to you, please, please go somewhere else. Go somewhere else. But listen to your body and get those screenings. Get those screenings. And so we're going to go ahead and open up for Miss Margaret. Miss Margaret is just a beautiful soul. I met Miss Margaret actually when I was working as an inpatient nurse practitioner at one of the facilities here, and we've just stayed in touch. And I learned that she was dealing with cervical cancer, and we had spoken actually last year. And I was like, Margaret, are you open to sharing your story and letting people know, spreading awareness? So we're gonna have her come in today. We're so glad that she's here and grateful that she's willing to share and just be transparent with us. So you all welcome Miss Margaret. She's going to talk to us today.
Just want to start off by saying hello and thank you both for the opportunity to be here and share some information. And hopefully, I pray that this message is received by whoever needs it. So glad our paths crossed 2 years ago back at that facility. But where do I start? I'm not sure where to start.
Yeah.
It was such a long and difficult journey that I'm still on. A lot of people think that the journey stops once the treatment's over, and that is far from the truth. So,
When did you first realize that something wasn't right?
so going back to what Tiffany mentioned about kind of not checking on yourself and kind of shrugging things off. I work in healthcare as well, and I feel like I chop a lot of things off. Oh, that's normal, that's normal. And so I was having a lot of irregular bleeding, and I chopped it up to just a regular menstrual cycle and stress and things like that. So, but a few months and it was still happening. And so I said, oh, okay, something that must not be okay. I was having a lot of pain and a lot of irregular bleeding that I figured, okay, let me start making an appointment and see. Went to my PCP first, and they scheduled me to go to see the gynecologist. From the gynecologist, as soon as I went there, I knew something was wrong. I mean, she did the pap smear, she did, a full thorough pelvic exam, and she's like, something's not right, but we're going to get to the bottom of it. And I'm so grateful that she took action. She's a PA, and she just jumped immediately and sent referrals and sent labs, and I mean, she did so much. That she really, really, I mean, I saw her a few weeks ago and I almost cried. I'm like, thank you again, because she really jumped in very quickly. And so that was in December. I was going on a trip for New Year's. The day before I leave, she calls me and she's like, I'm so sorry. I know it's the holiday, but, and when I heard the but, I said, oh, all right. And she's like, your labs came back very, very abnormal, and we're going to refer you to the oncologist. And you just hear those words, and I broke down, And I said, well, I'm going on a trip tomorrow. I'm going to enjoy my trip. And when I come back, I'll figure out what's going to happen. So that's kind of how I found out something was wrong. Yeah.
And so, came back from your trip. What happened next?
So I came back from the trip. Now it's, mid-January. They'd already scheduled me for the oncologist. I went to see the oncologist. I actually saw the PA as well at that office. And she started doing her exams and pelvic exams. And she also had this look. It's so different when you're on the patient side of things, because I'm laying on that table and I'm looking at her face, and I just, something's wrong. And she did her exam. She did not a colonoscopy, a biopsy, right there in the office. She asked her medical assistant to step out of the room, and then I said, okay. And she's like, she grabs tissues, and as soon as she grabbed the tissue, she starts walking towards me, and I'm still frozen looking at her. And she said, obviously we have to wait for the official results to come back. I did do a thorough exam. I am pretty positive that it's cancer. And I think I froze. It's one of those moments that you're just sitting there and you're frozen in time, and you're looking at her and she's talking and I'm not crying yet. And then at some point I realized that I'd been holding in my breath, and then it was just a dam, and the waterworks came out. I mean, you think cancer, you're going to die, and she's like, we're going to get through it. She held my hand. She's like, we're going to take it step by step. And, and I said, okay. Okay. And I got myself together. I walked out of that office. I remember calling one of my best friends when I left, telling her what was going on. And my voice is shaking now because you can just feel that emotion still so raw, like that same day,
And those emotions are something that you probably never experienced before or since.
Never.
How did you care for yourself during those times, emotionally as well as physically?
That's a good question. I always have been like a big advocate for, feel what you feel when you feel it. Like, don't shrug it off. Don't, it's going to be fine. It's going to be fine. You feel what you feel, and then you get back up. And that's literally what I did. I mean, I think that appointment was on a Tuesday. I called out of work the rest of the week, and I just cried and I prayed and I cried and I talked to God. It was dark, literally and figuratively. I had the blinds closed. I didn't want to see daylight. I literally just cried and talked to God all week. And I remember one day, because I thought about everything else I've been through in my life. And I'm like, I remember telling myself, Margaret, you got to get up and fight. You got to get up and fight. And I literally, my voice is cracking because I literally said that to myself. And I said, okay, let's do it. Let's do it. And that's not to say that I didn't have, obviously, tears and emotion throughout going through treatment, but I did give myself that week to just sit there and just feel angry at myself for not taking care of myself or catching it sooner, or angry with myself for not reacting quicker. I mean, I don't know. I was almost angry at God for a little bit, like the why me set in. But I allowed myself to feel it. I allowed myself to feel it.
And I think that's so important that you gave yourself that time to sit with those feelings, to grieve the things that you were going through, the life that you had been living. All of that is completely, completely common given the circumstance. But thank you for your honesty with that, because a lot of times people think that we just immediately have to jump right into the fight mode. And you got there eventually, but
Yeah.
you gave yourself time to process, which is so important.
Absolutely. Yeah. It was necessary.
Yeah, yeah. So, oh, go ahead. I was going to say, and so then what happened next on your journey?
So the results were back. The official results from the biopsy were back. I went back to the oncologist office. I took two of my best friends with me for support. That oncologist office was just a nightmare. The physician, I think he might have spent maybe 5 whole minutes with me in the room. I think he might have read my chart as soon as before he walked in the door. It was very quick. He sat down. This is what we're gonna do, and it was very, it's like a sales pitch, almost, right? And he said, well, we don't know if it's cancer yet. And so I said, well, what do you mean? I said, I referenced the PA. I said, this is what she shared with me. These are the results she shared with me. He's like, well, we're going to have to do a more in-depth biopsy. We're going to have you sedated. You'll be in the hospital for 2 nights. And I'm like, wait. I'm like, why are we wasting time with that? We're wasting time. We need to act. And I said, if this is a matter of, preserving, anything down there, I don't, I'm not interested in having kids. I've never been interested. I'd rather go for the hysterectomy if I can. I'm not worried about your child caring wants or something like that, he said. It was very cold. And I was like, and I just stood there kind of frozen. And then one of my friends kind of like stepped in and she's like, well, bring her in. She gets a little crazy, a little rowdy for her girl. And she's like, bring her back in because she's the one that said X, Y, and Z, and you're saying something else. So she's getting animated. I'm just sitting there frozen. They step out. I start crying again. They're obviously having discussions. And I said, okay, this is what I'm going to do. I'm going to leave. Like, we're going to finish the appointment. Whatever we're going to do, I'll call you guys to reschedule, whatever you want me to reschedule. But I left that appointment, and speaking to advocacy that you were mentioning on, I was like, no, I'm not going to go through with this provider. I called my PCP. I told him what happened. He said, absolutely not. Come to the office right now. We're going to get you situated. That's not okay. And they went and they put in a referral to an amazing oncologist, Dr. Veronica Shimp, who was amazing. And I remember when I met her, it was like night and day. I mean, she sat there, she held my hand, she explained everything with, very thorough, very knowledgeable, very compassionate, just night and day from the first physician. Night and day. I mean, I think I was in her office about an hour and a half, whereas the first one took about 5 minutes. It was just night and day. If there's anything that I can obviously share about that portion of the journey is definitely go for second, third, fourth opinions. Speak to somebody that's going to listen to you, like you were mentioning, that's going to take the time, to talk to you.
So what happened once amazing that you found that provider, and a lot of people don't get that second opinion, And so you met with her. What was your treatment like?
So the recommendation was not a hysterectomy. They did say that the cells were starting to spread. And so, she pretty much said, we can do a hysterectomy, but we would still have to follow up with chemo and radiation. That's just going to be a lot on your body right now. We're going to be wasting time. And the way that she made me feel just in that first session, I said, I trust you. Whatever you want to do, that's what we're going to do. And so she immediately set me up with the radiologist. And by, let's see, I think April. I think it was April. They started me on my first radiation treatment, April 1st.
And I know a lot of people in this room maybe have never been through radiation. How was that for you, and how did you get through that mentally? What was your support system like?
I'm the type of person that when I'm going through something, I isolate and I just want to take care of it, go in battle mode. Like, I'm not a person that wants to share the misery or I don't want to bring any bad vibes to people. I don't want to. So I was like, I'll go to these appointments alone. And when I tell you, Tiffany, nobody let me go to an appointment myself.
Absolutely not. Right.
Not even once. Not even once. And so I look back on it and I'm like, I'm so glad that they didn't let me. And so everybody kind of took turns. My sister, who's also a nurse, flew in from California. She stayed with me for a couple months. But radiation was 5 days a week. It was Monday through Friday, very early in the morning. It's a quick process as far as the radiation for cervical treatment. It was one of those things that I just felt like, okay, I got to do this before I got to go to work. I got to do this before I got to go to work. My mind was still like, I just have to get it done. And then chemo was once a week. So chemo, that was a little more intensive. You have to sit there the whole day, a couple of hours, IVs in your arms and fluids and anti-nausea medications and, taking your vitals every so often. And I was just, camped out at that, IV suite every Monday for 3 months. And again, nobody let me go but myself, you know.
You had a great support system.
Oh, amazing.
It made all the difference in the world, I'm sure.
It did.
I'm sure. Yeah. We see a lot of people who don't have that, and so do you feel like if that support was not there for you, that your journey would be different today?
Oh, 100%. 100%. I remember at the first session of chemo, my sister was there. She'd already flew in that weekend. And before the nurse came, well, the nurse was in the suite, getting the IVs and everything set up. And my sister says, do you mind praying with us first? And the nurse was kind of taken aback. I guess she, hadn't really like experienced that before or anything. She was visibly moved and she was like, absolutely. So we all held hands and my sister said a prayer. And I think that kind of like set the tone for the rest of the treatment, because I don't think I would have been able to get through it if I would have gone by myself like I wanted. I had another good friend of mine who she'd be in there. She's like, let's make TikToks. Now she's like 15 years younger than me, but I call her like my little sister. I'm like, I'm not doing a TikTok. Lo and behold, I have several TikToks of me and I've got the IV pole there and I'm connected to everything. The nurse is coming in like, what are you guys doing in here? I'm like, she done talked me into a TikTok. Other times I just have my laptop out and I'm working. So, we made the best of it.
Yeah, absolutely. And so I know you work. You work the whole time.
I worked the whole time.
Okay. Yeah, and how was it?
It wasn't bad, actually. I think I needed that to kind of keep my mind busy and keep a purpose that I got to keep going, I didn't take any time off throughout the actual treatment. Those 3 months, I was still very much working. And I will say that once treatment was over, so 3 months have now passed. I've gone through chemo and radiation. At the end of both of those cycles, they said, we're going to recommend you for, I'm going to mess up the name, brachytherapy, I think it's called. Or they pretty much, put you under, they insert a device. That device is now going to connect directly to to the radiation, and it's going to zap, I just say the last few remaining cells. I think that was probably the hardest part of my journey, is going through that procedure twice. I'd never been put under before. I'd never had a major surgery. And so I was so nervous about anesthesia. I'm like, what if I don't wake up and this and that? And, my sister was there. Everybody was there again. They're like, nope, we'll be there. But I remember waking up from the first time that we had to do it. And I was in so much pain. I was crying and I was like, why is this happening? Why me? It went back to like the why me. But once that was all done and treatment was all done, I got into this big depression. And I didn't know what was wrong with me. And I remember being in my bed and my sister's still staying with me and I'm just not even engaging with her. I'm just sleeping all day. I didn't want to work. And I remember sharing that with the radiologist, and she said, well, that's totally normal. Your mind has now finally caught up to everything that you just went through. She's like, you didn't stop working. you were still working the whole time. And so you were just go, 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 go. And she's like, this is very normal that once treatment stops, your mind is catching up to all the trauma you just went through. And I'm so glad that I shared it with her because I almost kept it to myself. Another thing like, oh, it's fine, it's fine. It's probably just, maybe whatever. I was just shrugging it off. And when she asked me, I said, do I say anything or do I not? And I'm so glad she did. And she's like, do you want to take some time off of work? And I was like, yes. So I took a month off then.
I'm so glad that you spoke up. I think people in general, but particularly women, high performing women such as yourself, we tend to not want to admit when we're having a hard time. We see it as a sign of weakness, but in fact, it's a sign of absolute strength to say that, you know what, I'm struggling a little bit. Things are a little hard right now, and maybe I need to do something different. And I'm truly in awe of you, Margaret. You had a physical strain, you had an emotional strain. Spiritually, your walk was being challenged too, but you still persevered. You never gave up. And even when it got dark and when it got difficult, you still fought. And I think that tenacity, that strength is a testament to who you are. Tiffany started out by saying that you are just an amazing human, and I think your story truly embodies that. You're welcome. Thank you for your honesty and your transparency. It's truly, truly an amazing journey. And I'm so glad that you let that first doctor go.
Oh, it's very necessary.
Whoa.
Very necessary.
Yes. And just that advocacy, you know your body, you know what you deserve. So good. I'm glad that you did that. I'm glad. And let me tell you all about Margaret. Margaret is all over the world. She is living her best life. I love it. So tell us, fast forward to now. How are things now? Because there was a lot that's happened, and this is the third year, right? The third year anniversary.
This month marks 3 years since I was diagnosed. Yeah. Like I mentioned earlier, the journey doesn't stop just because treatment stopped, which I, quickly found out when I started feeling that way. I mean, there are some health issues that I'm experiencing now that are effects from the treatment or effects of, life in general in that year or so that everything happened. I do chop those up to just, I can deal with those. I do have neuropathy in my feet and my legs. That's fine. Some lymphedema. I feel like I'm experiencing some of that. So a lot of like medical things that I'm still kind of dealing with, which again, compared to chemo and radiation, it's fine. Mentally, I feel better. Physically, on the other aspect of going through those things, those side effects, I have started working out and I'm trying to take care of myself and do things that I feel like I should have done before this happened, and I try not to beat myself up because I know everything happens for a reason and the path is the way it was supposed to be no matter what. I hated working out before. I hated it. And now like I miss the day, oh my God, I don't feel good. You know? So things like that and keeping up with doctor's visits, early detection. I mean, I think if I would have listened to myself when I first started questioning what was going on, I would have caught it sooner. Thankfully, it is one of the slowest growing cancers, and so I was still very, very fortunate. But I remember asking the physician, based off of the tissues and the biopsy, how long do you think I've had this without even having any symptoms? And she said, you've probably had it about a year. I was diagnosed at 37 years old. That's very, very young. So these days I'm a little bit more proactive and definitely, sharing those proactive measures with friends and family so that they don't, find themselves in a situation where they're like, oh, I should have listened,
So how do you prioritize yourself now? You're working out, you're doing all of those things, but you have the beauty of hindsight, right? Looking back, what are you doing differently emotionally for yourself versus what you were doing before?
Oh, that's a good question.
Thank you.
I think it goes to when you work out and you're eating healthier, when you're intentionally spending time with good people, that's helping my mental health. That's helping a lot of mental health, honestly. You know what I mean? That all ties together. Creating boundaries. And, I used to love work, and I love work. I love it. I love what I do. But in hindsight, I wouldn't have been chasing the dollar so much. I would have slowed down a little bit. So now I feel like I do have the wherewithal to, like, okay, the phone's shut off at 5. I can't help anybody after 5 or 6. You know what I mean? That is something that's an active work, though, in progress, because you know how I am, Tiffany.
I know, yeah, I do. And she's great at her job, by the way. She's amazing.
Thank you.
She's a powerhouse. For sure.
Thank you.
The boundaries. I just really want to touch on that a little bit more because, again, I think that's something that everybody in some aspect, whether it's work or personal, creating those boundaries. No is a full sentence, exclamation point.
Yes, ma'am.
And so, what would you say was the hardest part about putting boundaries in place?
Probably, the emotional aspect of it, of feeling bad for saying no, or feeling bad for, removing certain people from the circle or from, my everyday life. I feel like I'm very empathetic and very passionate, and I feel like, that's a good thing. But sometimes, it has this negative effects. That's probably the hardest part.
And so, with everything that you've been through, we have predominantly ladies in here. Hello to the gentlemen. Give us some key takeaways, just based off your journey, the hurdles, the things you've learned, the hindsight. What are some key takeaways that you can give this audience today?
I mean, prevention is key with most things. Don't listen to your body. I think that I know in hindsight that I wasn't listening to my body. I wasn't seeing the symptoms as something that were abnormal. I said, oh, this is normal for me. And right, some things might be normal for you specifically. Your body, when you don't start feeling good, but just not shrugging that off. Better be safe than sorry. Don't miss your appointments, don't miss your checkups, and advocate for yourself. Advocate for yourself. If I don't like you, then go to the next one. I don't like that one, I'm going to a third. And just find somebody who's going to take the time to listen to you and walk you through, because these things they're not easy.
Absolutely. And you're your biggest advocate. You did an amazing job. I'm proud of you.
Thank you. Thank you.
And I think one of the biggest takeaways from hearing your story is that through it all, the fear, the isolation, the physical pain, you still managed to continue to persevere. You still managed to be a support for others. You still advocated for yourself. You still found that strength. And I think that really is the differentiator in your story, because if you would have succumbed to all of those things, I think your story would have looked a lot different. And so I think that is truly an inspiration and a reminder to everyone here that you've got to speak up. We've all been gifted with a voice. We can't be afraid to use it, especially when it comes to our own bodies and self-care. It's not just a buzzword, the thing of the week. It's something that you've really got to walk in. It's a lifestyle. And we've only got one body. And so we've got to take care of it. We've got to proactively take care of it. And so I think your stance on prevention is really key. Going for those annual wellness checks, right? Making sure that you're paying attention to your body monthly, that you're doing those self-exams. Caring for yourself is one of the biggest acts of advocacy that we can do. And so I truly, truly commend you. I thank you for your wisdom, your vulnerability, and the grace that you've given yourself. That is an inspiration. So thank you. Thank you so much.
Let's give it up for Margaret.
Yes, thank you, Margaret.
Now we want to open up the floor because, like I said, we're here. Y'all come in, get comfortable. This is a conversation, so we want to hear from y'all. What questions do you have? Is there additional information that you want us to provide? Additional information you want to ask, from Margaret? Just let us know. We want to hear. From you. Any questions?
I know this group isn't shy.
None of them.
Good afternoon, ladies. I want to first say this is a great event. Thank you so much for having it. And Margaret, you're a pillar of strength. That must have been something hard. I had a cousin that died at 34, and she left 2 kids. So, and she didn't have a support system because she didn't say anything to anybody. She didn't say anything. So, by you saying, examine yourself, notice the difference, it is important. Again, ladies, thanks for having us.
Thank you, Candy.
What do your appointments look like now? Are they still annual appointments, or are you having to go more frequently because of the history?
Good question. Right now I'm at every 6 months. So the good news is my radiologist has already discharged me from services after the 2-year mark. So cue the waterworks again because she was also amazing. And she's like, well, I'm also relocating to North Carolina, so I would have discharged you anyway. And I'm like, but thank you so much. So, but I'm still seeing the oncologist every 6 months.
Some cancers are genetic. Is this one that is a genetic form or not?
So typically, no. For the most part, with cervical cancer, and there are outliers, it's HPV virus is the most common cause of that. At some point in our life, most of us will have that infection, and oftentimes the body clears it on its own, right? But occasionally that doesn't happen, and then when it's left undetected, untreated, then cervical cancer can happen. There are, again, other cases where HPV is not the culprit, but that's pretty much the risk factor.
And now, can cervical cancer lead to uterine and ovarian cancer?
If
Because I
not
know you said yours started to spread.
Yes. So if not treated, it can what we call metastasize or spread to those other organs. So really the emphasis on early detection, screening, listening to your body decreases the risk of that spread.
Thank you very much.
You're
And
welcome.
thank you for having this event.
Absolutely. Absolutely. Thank you.
Thank you so much for sharing your story with us. So, I'm a GYN provider, so this is like near and dear to my heart. But I don't necessarily have a question, but more of like a statement, and for the audience too. Um, I think there's a lot of stigma with HPV. It's a virus that's sexually transmitted, and we don't test men for it a lot of times unless we're doing a biopsy or something. So I see a lot of women that might have been in a relationship with the same partner for 20 plus years, and they think, well, I don't need PAPs anymore, or I'm going to kill my husband because I just got a positive test for HPV. And I don't ever encourage anyone to kill their husbands, but I like for patients to always remember that it can be dormant for years and years and years. And so you can get tested and do your PAPs every 3 years and be on the ball and then be like, well, I'm in midlife, I'm busy, I've been good for a long time. And I don't know if that was your case or not. And then just kind of neglect your GYN appointments because there's other things that are busier, your kids or your family, and boom, now we have HPV and it's progressed. So, typically it can be a very slow progressing cancer, like Margaret mentioned, but it's definitely one that you could have been in contact with the virus very early in life and not see a positive HPV on a pap smear or cervical changes for a really long time.
I have a question. I experienced postpartum depression, but when you were in your depression state, when I know you say it took time, but when did you decide to just shake it off and keep moving? Like, because when you get in that spot, it's dark, it's heavy. Was it your support system that made you pull out of it, or did you yourself pull yourself out of it? Like, what gave you that extra?
I think it was a little bit of everybody, including God. Everybody always asks me, how did you even do all that and still go to work? How did you even do all that? And we had no idea. You're posting pictures, and God. God was the only way that I was able to get through that. And so he gets all the credit, first and foremost, always. But, also the support system that knew, okay, this is another piece of that area of your life. This is another side effect of the treatment. What can we do? one of my best friends in the audience would say, how can I best support you? And I felt like it was such a good question because it wasn't those open-ended, let me know if you need me. How can I support you? You know, and like I said earlier in the beginning of the journey, really giving yourself that time to feel the feelings. Like it's not a bad thing to go through postpartum or depression or any of those things. Feel them and honor those feelings and sit with them and get uncomfortable with them. And I don't think there's a timeline on when you'll get out of that or when you say, okay, turn the switch and now I feel better. Everybody's, body's different. Everybody's journey is different. I think for me, it wasn't, just 30 days that I took off of work and I felt fine. It was definitely a slow progression to kind of feel better and feel like I can breathe again. You know what I mean? So it wasn't, I think probably by the end of the year, I remember I went on a little girls trip to Chicago with a friend of mine, and I think by December, that was now December, I said, okay, I feel better. Like, I feel like I'm going to put myself out there to date. I'm going to put myself out there to enjoy and not be scared. So, I mean, yeah, it took a couple months after treatment to start really getting out of that funk.
And just to chime in on that, I think we talk about stigma, as Ashley mentioned. There's stigma around that too. There's still some very difficult conversations around mental health that need to be had, and there's nothing to be ashamed about, embarrassed about. I think recognizing it is the first step that things are not quite right. And then leaning into your support system, whatever that looks like, whether that's family, whether that's your providers, and then getting help, right? And so for some people, maybe that's individual or talk therapy, counseling, could be medications, could be a combination of the two, but making sure that you don't just think that, oh, it's going to go away, oh, that this is going to get better. Yes, with time, things can change, circumstances can improve. But if it's truly diagnosed as depression, there is definitely a need to follow up with your provider, whether that's your PA or your NP or your physician, whoever's providing that care for you. But you're not alone. It just acknowledging that there is a problem is the first step, that things are just not quite right, and that's okay. So great question, Corbett. Thank you for that. And shout out to the friend that asked, how can I support you? Because I think that is beautiful. And the way that you frame that is amazing.
I just want to add how amazing Margaret is. I am so proud of her. She fought this fight with so much poise, so much faith, so much courage that I don't think she realized we drew strength from her. More so than we could have ever given to her. I know I didn't want to cry again. But I just wanted to say, Margaret, I love you so much. And, I love you, girl. And I am just so proud of the woman that you have become through this journey and how God is continuing to use you all for his glory. You have a story for his glory. And this is just the beginning, and I'm here by you whenever you need me. You got this. And I just am beyond proud of you. I'm proud of you. Love you. She's an amazing friend.
I saw I was gonna make it to the whole session without crying.
Come over here.
Okay. Hi, Margaret. I just had a quick question. So I know that you mentioned in the beginning when you first started seeing some symptoms, it was some abnormal bleeding, and the nurse practitioners also said that sometimes there's no symptoms. But are there any symptoms that we should be looking out for to kind of just raise that red flag? I am going to get your card after this, by the way. But is there anything we should be looking out for that could help?
I mean, just for me, I didn't have symptoms for so long. And, when I started having them was just the regular bleeding, a little bit of pain. And so maybe they might know some other symptoms that might be present. But for my particular journey, that was how I started figuring out something was wrong. And as you heard, it was already a year past of me probably having it when the symptoms began for me.
And that's the thing about cervical cancer. It is a slow growing cancer. And a lot of times we don't have symptoms in the beginning, but it is that, the irregular bleeding or persistent bleeding. You can have some cramping, discomfort. The takeaway is if you're noticing, you're normal, your baseline, right? So if you're noticing, okay, I'm bleeding here, like what's going on, or it's just bloating, just belly pain, any of those things, just get it checked. The earlier, the better. And then staying on top of your screenings, because when we do a pap smear, we can actually see changes before it even becomes precancerous, like an atypical change almost, just not quite precancerous or cancerous, but something we know we need to screen more frequently for. I gave a very brief overview, but there's a huge guideline for screening and treatment. So the key is get your pap smears. And if you've had an abnormal, do the follow up to make sure those cells are stable.
Great question, Josephine. Thank you.
Yes, definitely.
So after your treatment and everything, I know that there are some particulars that go with it. After you had the chemo and the radiation, did it throw you into any other things?
Yeah, medically induced menopause. So lucky me. Which I'm glad you brought that up because I forgot to mention that during my testimony is that the physicians and the whole team, they were great. Obviously, I can't speak highly enough about them, but I don't feel like there's enough education or prep for what happens after treatment's done. It's like, okay, bye. Literally, that's how it was. You're great, congrats, ring the bell, and that's it. And you don't know what happens. And so I didn't know about the depression that was going to come. And then medically, on the other side of that is, hot flashes I had. I couldn't sleep. I was having pain and tingling in my feet. And I was like, what is this? And it took me asking the doctors or telling them about these symptoms. Oh, yeah, that's because of this. We'll write you a script. Oh, that's because of this. And I'm like, well, there needs to be more education as to like what happens after, and I remember on a girls' trip we took our annual girls trip, and I remember being out there. I mean, it's an island, the island side, and I was hot all the time. I'm like, it's so unusually hot. Why am I sweating so much? I couldn't keep food down. I'm like, something's not right. Again, talking to the doctor when I came back. Oh yeah, we're gonna place you on hormone replacement therapy. That obviously helped the sweats and everything. And I'm like, why wasn't this said beforehand? So yeah, I am on hormone replacement therapy. I did have medication for the tingling and the peripheral neuropathy. I still have that every so often, but it got much better. But it did put me into medical menopause. And so that's been fun.
You could come see me.
And so I just want to share in this room, we're all about connections and networking. I have two ladies at this table who specialize in menopause and women's care. So Miss Kendi is a menopause coach, and then Miss Ashley Auth is a physician assistant. She owns Positive Women's Care. So for you ladies, could you speak a little bit more on that and what that looks like as far as after chemo radiation, your experience and perspective on it? To share with the group?
So yeah, so a lot of times, whether you go into natural menopause or if you have um, a hysterectomy where your ovaries come out, radiation to the pelvis, which is gonna, decrease ovarian function. A lot of times we should be putting women on hormone or having the conversation about hormone replacement therapy before we undergo radiation. So there's this bridge of care. I could preach on this topic for hours, and I'm going to share the mic here. But yes, so and the depletion of estrogen, you know, I don't know if you've experienced any of these things before. You got your hormones, but brain fog, joint discomfort, pelvic changes, recurrent UTIs, vaginal dryness, bloating and GI issues. I mean, I could keep going, right? All the above. So again, I think sometimes specialists, and I'm not knocking oncology, GYN oncology, they obviously saved your life, right? But I think that they forget that it's an ongoing process now, right? So if we're going to remove ovaries or diminish the ovarian function, we have to do something to preserve that function in another way. So
just to reiterate, like she said, the after effects is like horrendous. And just to take up for doctors, they don't really get trained on menopause, so they don't know. And that's why people like me and Ashley have taken it up, because it's needed. The knowledge is needed. And like you said, you have to pay attention to your body. And also, once you reach 35, your estrogen levels start going down, and you'll start experiencing, like, I get a lot of people who say, oh, I got a pain in my hip. The hip pain won't go away, but they're getting treated. They're going to a chiropractor and everything for hip pain, but it has nothing to do with her. It has to do with menopause. A lot of people don't know that the hip pain and the loss of estrogen comes from menopause. So just be aware of your body and the symptoms that you're feeling. Like she said, the brain fog, people just walk around. I know a lady right now, she thinks she's in full-blown dementia, and it's not dementia. It's that she's just, her hormones are depleted and she's in menopause, but they're treating her for dementia, which is horrible. She's only 54.
Oh, I do. I just wanted to ask, thank you all so much for hosting this event, and thank you for sharing your story. I have been on a similar, not cervical cancer, but dealing with reproductive health issues and advocating for myself, even having to leave Brevard County to get the help that I need. Question, as we know, women's health is severely underfunded, and as you have discussed the many side effects during, before, and after, are there any positive technological advances that we can look forward to help us with early prevention, even just negating, maybe bypassing some of these hardships, the neuropathy? Like, who would think that, going through radiation, you would have to worry about that? More holistic things that you can incorporate, but just from as we begin to get more integrated with like AI and using that in the medical field, are there any things that you all may know of that we can possibly look forward to in the future?
As far as AI and technological advances, I'm not aware. I know, just going back to the good old pap smear, as far as the early detection, it could negate the need of needing chemo and radiation. We know that neuropathy is actually a pretty common side effect after those types of treatments. Unfortunately, it kills those cancer cells, but it kills everything else too, unfortunately. And so just getting in there, making sure we're getting those screenings, listening to your body. I'm a proponent for early prevention and primary prevention, right? Once we're getting into the secondary and the tertiary prevention, at that point we're treating things that are already there. So if we can jump ahead, right, and look at the things that may potentially develop before they get there, right? And staying on those screenings, well, that would be your biggest help there in that. As far as tech, that's a really good question, Danielle.
I think Ashley had something that she was going to.
So it's not readily available yet, but a lot of offices have the opportunity for patients to do self-PAPs, which is a new thing. And it's actually a cervical swab that you can do on yourself, as opposed to having to go in and do the embarrassing, like in stirrups, and it's uncomfortable. And I'm not 100% like everyone should just self-pap, but I think that there's cases or trauma victims or, different women that have never been, sexually active and still need to have a swab, and they feel a little bit more comfortable. So I think they're slowly bringing, not necessarily AI, but just more technology to get more access to care for patients. And I think right now, just so no one goes in like, I want to self-pap. I think most offices that are offering it, you still have to do it in the setting of a doctor's office. So like you can go to the bathroom and self-pap, or do it in a room. You can't do it like at home. I don't know why, but that's what they say. Yeah. But that's just like a little bit further. Yeah.
Hello, thank you for being here and doing this. I'm actually a psychiatric nurse practitioner, so I came because I was interested to find out I was thinking about getting more focused on helping women that are going through menopause or women that are going through hormone changes. A lot of the time, what I experience in practice is people telling me, oh, I started forgetting things about a month ago. I'm having ADHD symptoms. My PCP said I have ADHD. And I have to provide education, of course, and say, hey, you're like a neurophysicist. You've never been on ADHD medication. I don't think you have ADHD. It's normally something that affects you lifelong. So that brain fog that you're talking about that happens, and some of these other symptoms that happen, there's a lot of co-occurring things that occur, both with menopause, with hormone issues, with psychiatric. So I was interested to find out, was there a focus? You said that you had some depression before. And then I was interested to find out, was there a focus on mental health or how you were going to get through this? Was that focused on, was that discussed, was that brought up?
Yeah, it was brought up for sure. That's a good question. They did give me resources for like counseling and mental health within the oncologist office. I never took them up on it. Um, Not that I'm against it whatsoever. I did end up seeing somebody of my like on my own research, my own one-on-one therapy sessions on, a site that a lot of friends had recommended for mental health. But yes, they did recommend like group sessions and wasn't for me. Again, I was 37 years old in a chemo suite where everybody else around me in their suites were, 50s and up. So I feel like we could have related obviously on the treatment and everything going on, but for me, I just felt like from my personal journey was just vastly different, and I wasn't going to be able to get anything from those sessions further than just we went through chemotherapy together. You know, I'm 38 now. By the time it was done, now I'm in menopause. There's definitely kids are definitely off the table, which, like I said, it never really was like in the cards for me that I wanted, but it was all these things I now had to kind of deal with on my own. And so I did take their recommendations and I just kind of said thank you. But I went and saw my own mental health therapist and did my own counseling.
Well, and I think it's important to mention though that kudos to the oncology office for having those resources available, for having it addressed, for having those conversations. But again, self-advocacy, you found a path that worked for you, and that's exactly how you wanted things to go, and you still sought the resources, you just sought them differently, which is okay too. You found the help that you needed that worked for you. Good question. Thank you.
So, just one other thing I thought about on my journey as well. Doing some research beforehand. I know sometimes you can get shy in front of doctors. It's like I know what I'm feeling. I don't necessarily know how to communicate what I'm feeling. One thing that I did was kind of create a guide for myself with selected questions and just because you never know what you don't know. Do you all have any references for like guides or, like a list of questions you can provide if you just had some general.
Yeah, it's actually something that we offer with our advocacy practice. Yeah. And with every client that we have, what we do is we sit with them and we do appointment prep. So before we go in, let's target the approach. Because let's be honest, I work in primary care. I get 15 minutes to see one patient. There's just not enough time. And so you're more likely to get your questions addressed, like you said, Danielle, if you go in with a plan. Sometimes patients come in and they throw 25 issues at us, right? So you get more bang for your buck, if you will. If you prioritize your concerns, go in with your top 3. Pick your top 2 or 3. And so we then can take that focus, that 15 minutes, and focus on those areas of concern and be more thorough with that. So instead of trying to unpack 25 things, I can give you more attention with the 3 that we're focusing on, or the 2 things we're focusing on, right? And just preparing for that. And it's okay to not have everything addressed right away. It's really based on what is most a priority to you. You're walking in your shoes. We don't know what you feel. We're, as your treating provider, we're there to be a resource for you, but we don't know what you feel, and we only know what's provided to us. So do the research, absolutely. Do the work and
And I would also add to that that one of the things that we provide our clients with is a continuity compass. It's a one-page handout, right, to make it easy in those 15 minutes for the provider. But it summarizes all the key things that are going on, kind of serves as those bullet points to kind of help drive those conversations. So the prep before the appointment, going in with that document, can kind of help streamline that conversation and make sure that any questions that you have going in are addressed.
I have a quick question. So I know you said earlier how you fell into depression and you were thankful because you wanted to be isolated, but you had a great support system that would not allow you to do that. So kudos, thank you. So for people who do not have that and go through cancer, like my dad went through cancer, it wasn't cervical obviously, but he isolated himself and we didn't know, I didn't know. For people who do go through that and won't allow a support team or don't have one, what are some things that you can suggest for them to help them so they won't be stuck in that depression?
I would rely in that instance, I would, if they're not going to share with friends and family the situation, to rely on the professionals to give them those resources like the oncologist did for me. And she did recommend these resources while I was going through it because she felt like I needed, I could benefit from the mental health counseling or those group sessions while we were going through the treatment. So for somebody that wants to stay secluded and not share with friends or family, maybe rely on those outside resources like the medical professionals who might be able to say, okay, here's a support group for, men's cancer every Thursday, and at least starting that way. You know what I mean? Sometimes it's easier for people to lean on strangers during that time period. You know what I mean? And sometimes they don't have that emotional connection with their sister, their daughter, their cousin, and so they're able to just connect on the treatment alone or the journey by itself. Um, and I'm always going to bring it back to your faith, number one.
And I would piggyback on that too. A lot of times people don't want to be burdens, right? They see it as a burden to someone that they love to share those heavy things, those dark things. And so, one thing that people that are actively seeking that treatment, they're going to do is they're going to go to their appointments, right? So that's why you want to make sure that you've got a provider that's really, really locked into all components of healthcare. They're not just focused on the oncology, they're kind of looking at that integrative piece. And so one thing that has been really successful in the literature is doing they have many assessments that they offer at each doctor's appointment. So when you come in, you get your patient paperwork, and so they'll do a little screening, and as a part of that check-in process, they are assessing for those symptoms of depression. And so usually there's a cancer navigator or a care navigator there in the practice that's reviewing these documents, and because they're going there consistently over a period of time, they're going to look back and say, okay, on your second visit, I did notice that you answered positively for these things. What's going on? Let's have some conversation about how you're feeling. And opening up that dialogue can also lead to some resources and some referrals and things of that nature. So great question, Danielle. Thank you.
This is not really a question, but this is goes to back to Danielle here. Back to what she said about not having the person wants to feel isolated. So that was my journey. I wanted to be isolated, but I had friends that wouldn't allow me to isolate myself. So I say to this, continue being, I'm here for you. If you need to talk, say something. This time you will speak up. So that's what my friends did to me, because before I was isolated, but this time, this is my second time going through postpartum. And then this time I actually speak up, and guess what? Now I'm not, I have my friends to help me. So that's what I can say to that. Still be there for that person. Still say, hey, I'm here. I'm listening. If you need to talk, those open the doors. And now I speak more. Now I use my voice. So if that helps a little bit,
And I'm so glad that you do.
Any other questions from the group?
I am loving this conversation.
This is
amazing, guys. Wow.
Yeah. I've been holding back tears. I don't know since because I'm just a big waterworks here. So, but yeah, this is exactly what we wanted it to be. And we want to do more of this. We want to sit down and just have these conversations. We don't talk enough about this. We don't talk enough about, and there's so many health topics. We're in January is Cervical Cancer Awareness Month, and we're talking about self-love, but there's so many things where we can just have these conversations. And it's a safe space. We want you all to be comfortable. Speak up, ask the questions. Let's lean on each other. That's what it's about. That's what it's about. Absolutely. Margaret, I'm so proud of you.
Yes, thank you.
So
And I just have to say thank you to each and every one of you for being here and being present, being vulnerable and sharing your own stories and your own journeys, your own wisdom and skill and experience. There is a lot of wisdom in this room. There's a lot of talent in this room.
Yes.
And I know that we want to highlight some of those individuals who are here and supporting us. But first, we would like to invite Miss Carol and Miss Akili to come up here and join us.
Now, as they're walking up to us, we're going to just have them come in, and I want them to just share their journey of how they got here. This bookstore is amazing. And the ladies who run this bookstore, who own this bookstore, they always greet us with kindness and care. And
Every time.
I'm telling you, I love it in here.
Yes.
I love it.
Come on. All the way up.
It's filled with culture. It's filled with love. We just want you all. I know we're putting you on the spot.
Yeah, because they had no idea that we were doing this. Come on, Miss Carol.
We're putting you guys on the spot, but we want to just thank you. Thank you for your kindness.
Truly.
Thank you for your love. We appreciate you all creating this space for us to be able to do exactly what we're doing right now. It's life-changing.
You poured into us, you poured into this community, and we are so grateful for both of you. Thank you. Thank you. Let's give them a round of applause, guys.
Can you share with them what made you start the bookstore?
It really was a conversation over Mother's Day brunch. Carol had mentioned she'd always wanted to open up a Black gifts shop. And we said, oh, you should do that. And she goes, we should do it. And I said, you should do it. And we ended up coming together, and we started off online doing pop-ups. And then when this space came available, we just really felt like it was the right time and the right place. And we've been here for a year now, just growing and editing our collection thanks to what people say they want and need. And so we're so excited to kick off the year with this event because it really speaks to what we're trying to create here. And so we appreciate you all being here. We are 2 introverts, so this is traumatizing, but we are really grateful and happy you all are here.
Thank you all so much for filling the space with this love and information and bringing the tears down, but I'm an emotional person. And your story is just amazing, and I'm so proud of you and your strength. And more people need to hear about these stories and all these things that are happening to us and how we're not advocating for ourselves most of the time because we're afraid and we're trying to be quiet. We don't want to push the buttons. So we thank you all for being here in this space. And yeah, this one here, she's my head space. All the beauty you see in here is Akili. And I appreciate every moment of it. Yes. I love it. Thank you.
Thank you. All right. We'll let you guys off the hook now. You can head on back.
Now, I want to invite Miss Keisha Crum, up to the front here to talk with you all. Miss Keisha is one of our vendors here today. I know Keisha from high school, and it's been about that long since we've seen each other. But she's done some amazing things. And so, Keisha, I just want you to share with the group what brought you here. Tell us about your business. And
let's see, where do I start? So like Tiffany said, we go way back, and I think that was the last time we saw each other, was probably when I graduated high school. But I am on a journey of, my first book was Traveling Down the Journey of Purpose. So God gave me that title, sat on it, and I finally birthed it out in 2022, where we all are on a journey. We all have purpose. God has put something in each and every last one of us. No matter what it is, I'm a mother of, I call her my miracle. And so I have a daughter who has special needs. And so a lot of what God gives me comes from my journey with her, of like even the self-love book of neglecting myself, being a single mom, being divorced, and going through the motions of that as a woman, setting boundaries, you know, comparing myself, showing up for others and not myself, people pleasing, like all the things, depression that she talked about. And she said, like, going, I got this, I'm strong, you know. And especially women of faith, like, if we all are probably women of faith, we think, I can't say I'm depressed because that might mean God isn't good, or I can't say this, I can't say I'm down because, you know, so just taking a minute and being like, you know what, have your day. You know, sometimes I text my girlfriends like, today is not the day. Money had all these seizures and I'm just not feeling it. But just allowing myself to be in that moment, but still saying God is good and I love myself. And like, this book was for me first, you know, this journal that I wrote. And I told Tiffany, I said, I'm working on something, you know, and I would like to present it. Erin keeps coming out. And so, and that's what I did. And it blessed me so much. And I pray that it blesses others just to show up for yourself, like looking at where you're not loving yourself. Is it mentally? Is it spiritually? You know, is it emotionally? Like, it's so much more than, you know, getting a pedicure and a massage. All that is really good and that's nice. But look, doing like an inward check of myself of, how am I not? Like, what does it look like to me? You know, and that's what I had to ask myself. What does it look like for me, or even with my own health journey of, okay, you can take care of your kids, but who gonna take care of you if you're not taking care of yourself? So just all of those things. And so that's just kind of what God has given me, is purpose, self-love, and healing for broken women, because we go and go and go and we neglect ourselves. So that's kind of what God has given me. So yeah.
Thank you so much, Keisha. Thank you so much. We appreciate you. Thank you for sharing. And so I encourage you all to stop by and chat with Miss Keisha. We're going to break now and then just allow time for mixing, mingling. Grab some more empanadas. Miss Josephine in the back. I can't wait to get one. I'm excited. And we, again, just thank you so much for coming in and sharing this space. Talk, chat. We're here. Like I said, one big happy family. Most of y'all know me.
And,
so, yeah.
And please look around. There's
Yes.
lovely, lovely merchandise in the shop. So feel free to peruse and look around. I was in here yesterday and picked up a few things.
Yes.
And we are already just diving into some books we picked up. So there's some really good stuff in here, guys.
Definitely.
And actually, we didn't talk about this, but we need to do this because we have a gift for Miss Margaret to thank her for joining us today.
Yes,
we know that you are a lady of leisure and travel, and we just really want to thank you. I know that you've shared your story amongst friends and family, but we want to thank you for sharing it formally with the world. And yes, the story needs to be told. It deserves to be told, and I'm honored that you allowed this setting with us to be the place where you did that. So we just have a little something for you. Hold this for me. We just picked up a little basket for you. So thank you so much for being here.
Thank you.
We're honored.
Absolutely.
Yes,
Thank you, Margaret.
So much.
Thank you so much.
Travel fun.
Yes, absolutely.
Thank you so much.
Thank you for allowing us to be a part of your journey.
Yes, thank you so much.
And look forward to seeing you embarking on more of your own.
Yes. Thank you guys so
Thank you,
much.
guys.
And yes, go ahead. We're going to break and just allow you all to get up and move. Plenty of good things in here. Shop around, guys.